Good morning, Thomas. How are you feeling today?
Good morning, Dr. Albert. Not great, to be honest. I've been feeling pretty awful lately.
I'm sorry to hear that. Let's start with some background information. What do you do for a living, Thomas?
I'm a software engineer. I spend most of my day working on a computer writing code.
I see. What brings you in today?
I've been experiencing some severe symptoms over the past few days. I have a high fever, chills, and I've been feeling really weak and fatigued. I also have some difficulty breathing and a rapid heartbeat.
That sounds serious. Have you had any similar issues in the past?
No, nothing like this. I've had the usual colds and flu, but this feels much worse.
When did these symptoms start?
About 3 days ago. At first, I thought it was just a bad cold, but it got worse very quickly.
Have you experienced any other symptoms like confusion or disorientation?
Yes, actually. There were a couple of times where I felt really confused and had trouble focusing on anything.
That could be significant. Let's go over your medical history. Have you had any major illnesses or surgeries?
I had my appendix removed when I was a teenager, but other than that, I've been pretty healthy.
Any chronic conditions like diabetes or hypertension?
No, none.
How about your family history? Any major health issues in your family?
My father had heart disease, and my mother has high blood pressure. My grandparents on both sides had diabetes.
Thank you for that. Are you currently taking any medications?
Just some over-the-counter cold medicine. I took ibuprofen for the fever and some cough syrup.
Do you have any known allergies?
I'm allergic to penicillin. I had a bad reaction to it once when I was a kid.
That's important to know. Based on your symptoms and the rapid onset, I'm concerned you might have sepsis. It's a severe infection that can spread quickly and cause widespread inflammation in the body.
That sounds scary. What causes sepsis?
Sepsis is usually caused by an infection like pneumonia, a urinary tract infection, or even a skin infection. The body's response to the infection can become overwhelming and lead to widespread inflammation.
What should we do next?
I'll need to run some tests to confirm the diagnosis. We'll start with the complete blood count (CBC) to check for signs of infection, blood cultures to identify the bacteria causing the infection, and a lactate test to measure the level of lactic acid in your blood. High levels can indicate sepsis.
How long will the results take?
Some results like the CBC and lactate test should come back within a few hours. Blood cultures can take a couple of days as they need time to grow in the lab.
And if it is sepsis, what's the treatment?
If we confirm sepsis, you will need to be hospitalized immediately. Treatment usually involves intravenous antibiotics to fight the infection and fluids to maintain blood pressure. We may also need to give medications to support your organs if they are affected.
What about the penicillin allergy? Will that be a problem?
No, we'll avoid penicillin and use alternative antibiotics. There are many options available such as vancomycin or meropenem, which are effective against a wide range of bacteria.
How long would I need to stay in the hospital?
It depends on how quickly you respond to treatment. Some patients recover within a few days, while others may need a longer stay, especially if there are complications.
This all sounds pretty serious. Is there anything I can do to help myself recover?
The most important thing is to follow the treatment plan and take all prescribed medications. Rest is crucial, and once you are feeling better, gradually resume your activities. Avoid strenuous exercise until you are fully recovered.
What about follow-up appointments?
We'll schedule a follow-up appointment a week after you're discharged from the hospital to check on your progress and make sure there are no lingering issues. If you have any concerns or if your symptoms worsen, contact us immediately.
Okay, I understand. Thank you, Dr. Albert.
You're welcome, Thomas. We'll take good care of you. Let's get started with those tests. I'll have a nurse come in to draw your blood.
Thank you. I appreciate it.
No problem. We'll get to the bottom of this and make sure you get the treatment you need.
Thanks, doctor.